Hello guys, welcome again to my channel. This is Dr. Doris. If you're meeting me for the first time, I am a registered doctor in Nigeria as well as in Australia, and I work as a GP in Australia. I am here today to talk about like how to go about pesci. Okay, I haven't really made a video about like how to really tackle the pesci questions, and I think I'm here to do that. I have made so many other videos on AMC, pesci, coming into Australia. You can check my other videos, run through my channel and look at my other videos. Okay, so guys, talking about pesci, right? Pre-employment examination is the kind of a pre-employment structured examination for GPs. It is the rate limiting step to you working as a GP in Australia. Okay, for you to be able to work as a GP in Australia, you need to pass pesci. Pesci is very important. As a matter of fact, if you're not gonna go through the pesci route, I don't see how working as a GP is gonna be possible in Australia. Although I have seen a lot of people now, because when I went for a GP conference, I found lots of GPs who came in through Asia and other countries, and they did what is called MD-RAP program, which is a kind of a way that like you write MRCGP examination through the through different pathways. I think people from UK, people from Asian countries, they have their own different boards conducting that exam, and I think the exam is being accepted by RACGP, and once you do the exam, you can then come in to Australia directly and work as a GP, because that is a kind of a way that is comparable to them, and you can finish up, you can come in working as a GP and finish up your fellowship. Most of the people that come in would just do like a year or 6 months fellowship, their own. They just go through the independent pathway, finish up their fellowship and write their fellowship exam to become a consultant GP. So it kind of makes it easy for them to transition from that country to Australia working as a GP, you know. I've seen a lot of people doing that, but aside from that, the only other way that you can work as a GP in Australia is through pesci. So even if, let's say that you've passed your AMC1, you've passed your English exam, and you don't have your pesci, you cannot work in Australia as a GP, because pesci is what qualifies you to be assessed by the APRA, which is Australian Health Practitioner Regulation Agency, before you can work as a medical doctor in Australia. Okay, I don't know if I'm making sense, guys. I mean, it's a lot of information, but I mean, it's something that if you really like calm down to understand what I'm saying, you would find that and then research more. Because what I believe is, when I say something, give you information, what I'm expecting from you is then to go ahead and research the information that I have given, because that is the best way, you know. Like, say you come on YouTube, you get any info, the best next thing to do is to go online, go to your Google, use your search engine and search the information that I've given, and you would then be able to read more about it. You'll be able to get more information about it that is tailored to your needs. Okay, so that being said, pesci is an interview which a lot of people underestimate, which has led to failure of so many doctors of pesci. If you underestimate any Australian exam, be it the AMC, MCQ or clinical or even pesci, you are going to fail. The thing never to do for any exam is never to underestimate it. Okay, pesci is an interview. Yes, you have to talk to you have to talk to GPs. Okay, so in your pesci examination, you would have like 3 doctors. Okay, and in that 3 doctors, 2 will be one. All of them are GPs. Okay, then with one nurse. Okay, who is kind of going to be the person that is your role player. okay, the community. So one of them represents the community, one represents APRA, and the other person is going to represent the state. Okay, so those are the three the three representatives you have in your pesci panel. So they would be able to judge like what you're saying, what you're answering, to know if it actually meets the standard of Australia in terms of medical practice, and that is what they will be taking back to APRA. One funny thing about pesci is that everything you say, they are writing it down, and that would guide them in giving recommendation. Let's say if they want to correct you about something, it will be from whatever you've been saying, and you make a mistake, they will just use it and say, okay, they will then make their recommendation from where they feel that you have gaps in knowledge. Now, what do the pesci panel expect of you? What I think is that you need to be person-centered, and aside from person-centered, you need to be an open-minded doctor to be able to pass pesci. And what does this mean? It means that in terms of doing your pesci, you need to consider every aspect of a patient. A patient comes in with headache. One thing never to do is never to miss doing your complete neurological examination, okay? After you finish that, like, you're gonna ask questions like relating to neurology. Think of all the motor neuron diseases, and according to the age of the patient, you also need to be, if it's children, you need to think of tumor. What tumors, brain tumors, are more often in children that can cause them to have frequent headache. Headache is a very serious complaint. But you don't just say, oh, it's headache. No, you have to make sure that you are thorough. That is what they're looking for. If it is an adult, you need to rule out, did they have stroke? Have they had TIA? Then you add other motor neuron diseases, you know, that all the possible causes of headaches. Then you then go into depression too as a cause of headache. Then you go into the person's lifestyle. Does he smoke? Does he drink? How well is the patient sleeping? You know, these are questions that are very important that they need to make sure that you know. But even while being thorough, you need to be fast. So you need to work with time as well to show them that you can finish everything that you're doing within 15 minutes. You can finish whatever you're asking, come to a diagnosis, management plan within 15 minutes, because that's the time you have. When you're practicing for your pesci exam, it is better to practice with 10 minutes so that you would make sure that you are used to finishing everything you need to ask the patient before the time frame or before the time runs out. So meaning you need to think, your brain needs to work like this. I'm laughing, guys, but it's not funny. That is the real thing. I mean, I'm just laughing to take away the tension from what I'm saying, but that is the real thing about pesci examination. Okay, you need to tell them that you are person-centered. You listen to your patient, very important. You respect your patient. Say you want to start doing physical examination, you can't just say, oh, okay, let me start examining, lie down. No. You need to tell the patient that I am going to do a physical examination on you, and this examination is going to involve me touching you and asking you to do some specific things. Do let me know when it is uncomfortable for you, and I will stop. Okay, so that is what it's like, what they want you to know in terms of like, okay, how do you communicate with your patient? Do you communicate respectfully with your patient? And you need to acknowledge, okay, a patient comes in with headache. You can't just say, oh, headache, when did it start? What you start with is, do you have headache now? Are you having headache now? This is the number one question. A patient says, I've been having headache for the past days, Next question that shows that you're empathetic is, do you have headache now? So if the patient says, I have headache now, next thing you say as an empathetic doctor, oh, I'm so sorry to hear that. Can you tell me how painful this headache is on a scale of 0 to 10? And the patient will say probably a 9. And you say, oh, I'm so sorry about that. Do you want me to give you a painkiller for this headache so that you'll be more comfortable while we talk? The patient can say, I can handle it, doctor, but at least you have asked. Okay, and if the patient says, okay, that is okay, then you say, are you allergic to any medication so that I can know what to tell the practice nurse? And The patient will say no allergy. Then you say, okay, that's fine, and I will have the practice nurse to get a painkiller for you while we continue. Then you just give it a brief pause and then say, are you happy for us to continue? The patient will say yes. Do you see how you communicate with your patient? Like, I'm just giving you like a life scenario and an instance of the best way to like talk to and communicate with your patient. It is person-centered. You can't just come and, oh yeah, this is a patient, lie down now, let me start. No, you have to make sure that your patient is carried along in every step of the thing you are doing for them. And that is what is called that you are having a communication with your patient. Okay, so that is what the pesci panel wants of you. Now, depending on your level of supervision, you need to actually understand that if you are going to be talking to a patient, okay, you would, even after you finish your history taking, do your thorough physical examination. Say your focus examination is abdomen. Even if you do your focus examination, remember, abdominal exam always end with a digital rectal exam, except the patient is not comfortable. And for you to do it, you will tell the examiner that I'm going to ask the patient if he's interested for me to get in a chaperone, and the chaperone will come in and I will do the digital rectal exam. They might tell you to skip that, and they will still give you the finding because you had already said you were going to do it, okay? And even if that is your focused exam, you will still go ahead and do a quick, you will still check the patient's vitals, of course. You will still do a quick general exam. So you're looking for pallor, icterus, clubbing, cyanosis, lymphadenopathy, and edema. I use pickle I nicknamed that as pickle when I was doing my own pesci examination. You do your quick general examination, skin color changes, and then check vitals, BMI of the patient, you know. And after you finish checking the BMI of the patient, you will also still go ahead to do even after you take the BMI, you also still go ahead to do a quick respiratory, a quick cardiovascular, and a quick neurological examination, okay? Even if your focus examination is abdomen, because you never know what you can find. You might just be saying this patient is coming with abdominal pain. Okay, what if it's an inflammatory bowel disease? You will see the skin manifestations, skin stigmata of of inflammatory bowel disease, IBD. You will see it on the skin. Sometimes you see erythema nodosum. Sometimes if you do a rectal exam, you see the anal fistula, you know. So you would know that, okay, that is why they want you to be thorough, and you still do a quick other examinations. You get what I mean? So that is it for that one. It's just, and then in your management plan, a lot of people do not check this, but in your management plan, you need to make sure that you tell the examiner that you are gonna like involve your supervisor. If you're writing pesci at a level 1 supervision, you need to make sure that you need to involve your supervisor in every step of the way. And for whatever thing that is wrong with the patient, remember the non-pharmacological approach first of all, which is the lifestyle modification, exercise, diet, physio, depending on what is wrong with the person. Then you go into pharmacological. It is very important to put every aspect non-pharmacological, pharmacological. And after seeing a patient, you need to give the patient what is called a red flag. So that red flag are the symptoms that when a patient sees, they know that they need to go back to the hospital or represent if you're working in a GP practice. So let's say if a patient comes in with abdominal pain and you're suspecting that this might be a gastritis or a peptic ulcer, and you say, okay, just take pantoprazole while we do, let's say you do your urea breath test, and you say, okay, while we're waiting for the result, okay, let's commence you on pantoprazole. So you will still give the patient red flags, like if you start bleeding, if you start having bloody stool, if you start vomiting blood, you know, these are red flags, okay? And if you start having uncontrolled like abdominal pain, or you notice that you're no longer able to go to toilet, or you're no longer able to pass wind, please represent come back here or go into the hospital. That is a red flag you've given to the patient, and that is also called safety netting, because you are safety netting your patient and telling them that, okay, if it gets worse, because things can change. You might see a patient now and you're 100% that, okay, you have done your best, you think that you got the diagnosis as a doctor, you think you gave all the right treatment, but the patient will go home and get worse. And the next question that the pesci panel wants to know is, did you safety net this patient? Did you tell this patient that even while we are doing this and this, if it gets worse at some point, please present at the ED. If not, then have a follow-up. So that is what is called safety netting. And follow-up, giving your patient follow-up is very important. Referrals are very important part of the pesci exam. You need to know when to refer. Say a patient comes in with a neurological condition, you need to know that you are going to refer to a neurologist depending on the condition. If it's a bowel complaint and probably you know that the patient will need a second review by a gastroenterologist, you will refer to a gastroenterologist. Those are the very important aspects of like the pesci exam. It's a lot, but you just need to know how to like put everything in place and apply all of these that I have said while you're doing your exam, and trust me, you won't get it wrong. If you're gonna do pesci, get a study partner that you do role play with. While doing your role play, set up time, work with time. If you can finish your taking your history taking physical examination within 10 minutes, you're good to go. So when you finish your role play with your role play with the with your groups, do alone too. Look at the mirror, talk to yourself, and most importantly, read the guidelines, read the different conditions, so that you will know when to change your diagnosis and when to incorporate this or that. You know, differentials are very important. You need to be very fast thinking in terms of making out differentials. A patient comes in with cough, what are you thinking? What are your differentials? Okay, a patient comes in with leg swelling, what are you thinking? What are your differentials? What I did that I found that helped me in the examination was that in terms of question, like when the panel would ask question, I went in with pen and paper, which you're allowed to do. You're allowed to go in with a white plain sheet and a paper. Okay, so a white plain sheet and a pen. So when they actually made when the doctor read the questions out, I just took note of the question and I wrote them down. Okay, after I wrote down the question, then I wrote down my differentials. Sometimes they'll be waiting for me to talk. I just take 1 minute within myself to kind of organize my thought, because you know, if the first okay, I will tell you guys something. The first question I got asked when I did my pesci, I told the examiner that can I just have 1 minute to organize my thought? And do you know the response they gave me? They were like, you can take all the time you want organizing your thought, but what we know is that once your time is up, we'll go to the next question. And I'm like, okay, wow, that is a big one. So I had to quickly write down. It still didn't make me to start talking, because I know that I will say rubbish if I don't organize my thoughts. So I just kept quiet. I didn't say a word anymore. I've written down the question that they've given me. So I took my time, wrote down all the differentials that I thought were the things that would apply to that particular case. I wrote down all the differentials. Then I started asking my question. I tailored my question towards all the differentials, and I actually got the right answer because I had already written down all my differentials. So it helped me to conclude my history taking, did a thorough physical examination, did my management plan while involving my supervisor, and that was how I finished the case. And it was really good. I mean, my pesci result didn't have any recommendation, and I mean, when I showed people, they were like, they didn't recommend anything. That means you must have done very well in your exam, you know, because I didn't have any single recommendation. They didn't know what to tell me. So, I mean, I guess I'm a bit of a talkative, right? Okay, guys. I hope I've been able to inform you today. If you enjoyed watching me, okay, do well to hit the subscribe button, and thank you so much for being here. Do well to like, to comment, to share, and I will see you in my next video. Bye.